Leader psychopathy and workplace emotional exhaustion, the uneven distribution of psychosocial hazards within organizations. Workplace emotional exhaustion has been rising for decades, reaching its peak during the COVID-19 pandemic. In Australia, about 46% of employees feel burnt out, and 92% of workplace serious mental health issues are attributed to work-related. Similar trends can be found in the US and the UK. Safe Work Australia recently reported that work-related mental health conditions are on the rise, leading them to issue the Code of Practice for Managing Psychosocial Hazards under Section 274 of the Work Health and Safety Act 2011. The code mandates that Australian employers must honour their responsibility to identify, assess and eliminate workplace psychosocial hazards and risks, suggesting they are just as threatening to employees as physical hazards. Emotional exhaustion has been shown to be a key factor that is detrimental to workers' satisfaction, engagement, performance, and intention to leave. However, some suggest that, in focusing on emotional exhaustion, we may be attacking the problem from the wrong angle, as it is centered on the employees rather than the organization. Supervisors, for instance, have direct influence on employees' exhaustion, and extensive research has shown that leaders' actions are major factors of stress for their subordinates. Moreover, a leader's personality has been shown to affect their subordinates' work behaviors. Leaders' dark triad personality traits and psychopathy have also been associated with a reduction in employees' well-being and career success. As such traits are manifest by shallow, manipulative, and cold-blooded behaviors, they cultivate disharmony and breed workplace conflict. Psychopathic leaders create toxic work environments that increase subordinates' emotional pressure and exhaustion. Furthermore, corporate psychopathy is more common in higher-level hierarchical positions and is also positively associated with leadership emergence. Consequently, the potential toll on the workforce of dark triad leaders is not trivial, constituting a psychosocial hazard of growing concern. Despite this evidence, our understanding of the relationship between a leader's psychopathy and their subordinates' well-being remains incomplete. Past research has largely assumed that the negative influence on the workforce is evenly distributed, occurring in a somewhat uniform manner across all staff. Hence, the question of who is most impacted by leadership psychological hazards remains yet to be determined. This is not a trivial oversight, as, related to this, extant research has shown that women suffer more from poor mental health than men, and it is proposed that this is related to an accumulation of discriminatory practices, gender pay gaps, gendered occupations, and other gender biases. Similarly, younger workers are more likely to experience high job strain, workplace bullying and inequity of treatment, all factors that can increase mental health problems. Indeed, the damaging effects of managers' mental health on an organization and its members were flagged 15 years previously, suggesting workforce consequences result such as absenteeism, poor decision-making, anxiety among followers and health-eroding retaliation behaviors. The aim of this study is to expand understanding of the negative effects of psychopathic leaders on subordinates' emotional exhaustion. The study focuses particularly on identifying the sensitivities of this relationship in relation to employees' hierarchical positions, gender, and age. Drawing on social cognitive and self-efficacy theory, this study suggests that not only is the exchange relationship with a psychopathic leader a direct contributor to emotional exhaustion, but also that the exchange is contingent on the follower's gender, age, and hierarchical position. Social cognitive theory postulates that people learn from their own experience and observing the behaviors of others. There are three major components that interact to influence a person's behavior: personal factors, environmental factors, and the behavior itself. Therefore, because of its focus on personal factors, including age, gender, and hierarchical position, and how these factors influence the relationship between leader psychopathy and emotional exhaustion, social cognitive theory appears to be particularly relevant to the current study. The study is based on a three-wave sample of 1,541 employees working in Australian organisations. Results showed that leader psychopathy increases subordinates' emotional exhaustion at all levels, yet we observe an accelerated effect for those with higher responsibilities, in particular managers versus non-managers. The positive relationship between leader psychopathy and subordinates' emotional exhaustion would be stronger for women yet moderated by employees' hierarchical position. The results confirmed that the association between leader psychopathy and emotional exhaustion was stronger for women than men. This positive effect is nonetheless not evenly spread across hierarchical positions. While emotional exhaustion is increased for both male and female executives compared to those in lower managerial positions, the magnitude and the differences across hierarchical positions are more significant for men. The results show that the association between leader psychopathy and follower emotional exhaustion is relatively homogeneous across the age groups, yet the effect was stronger for managers and executives when compared to non-managers for both the 30 to 50 and 50-plus years age groups. Drawing on social cognitive theory, this research goes beyond examining whether psychopathic leaders affect subordinates' emotional exhaustion by evidencing when this relationship is the most damaging and detrimental for subordinates in the workplace. The disparities and observed unevenness of the psychological hazards associated with leader psychopathy are particularly relevant to the Australian Work Health and Safety Act 2011 and the Australian Government's mental health strategy, which places greater demands on employers' responsibility to identify and reduce such risks and hazards. The objective of the mental health strategy is to ensure that proactive measures are taken to identify, eliminate, or minimize psychosocial risks in the workplace. The promotion of a positive workplace culture includes committing and supporting managers to develop their capability to create mentally healthy workplaces that promote a culture of positive mental health and well-being. The findings also suggest that a downward spiral may occur in organizations with psychopathic leaders whereby emotional exhaustion can spread across the different layers. Although it has been proposed that extreme and challenging demands can be seen as tools for developing effective leaders, leader stress can also trigger leadership behaviors such as poorer decision-making, being increasingly self-focused, or enacting destructive behaviors toward followers, including deviant, abusive, and unethical leadership. Consequently, leader psychopathy, by increasing followers' emotional exhaustion, is likely to create a downward spiral spreading across the different layers of the organization, from top leaders to executives to middle and frontline managers, eventually affecting non-managers. It has been argued that abusive leadership increases the likelihood of followers also becoming abusive supervisors at their particular level, thus reproducing and perpetuating workplace toxicity through a trickle-down effect. However, from a practical point of view, psychopathic leadership is a complex issue. The well-known quote, "Not all psychopaths are in prison, some are in the boardroom," provides an illustration of how much some dark traits are acknowledged and valued as assets by organizations when it comes to promoting employees. Some companies viewed psychopathic executives as having leadership potential, despite having negative performance reviews and low ratings on leadership and management by subordinates, which may be evidence of the ability of these individuals to manipulate decision makers. Therefore, the first step in the risk management process is to identify all work-related psychosocial hazards. This involves finding things and situations that could potentially harm people. Psychosocial hazards can arise from organizational factors, work organization, job design, and poor workplace culture, environmental factors, and individual factors. As psychosocial hazards also refer to interpersonal relations, including a lack of managerial recognition, bullying and harassment, they are more multifaceted and complex than physical workplace hazards. It is then clear from the study's results and discussions that Australia needs many more mechanisms, technologies, and pathways to integrate risk assessment and management of leader psychopathy and its hazards into Australian workplaces, and to ensure leaders' personality traits are monitored by workplace executives and board of directors.